Welcome to today's webinar titled A Policy Discussion on Smoke-Free Casinos. My colleague Mike Freiberg and I are excited to be joined by two of our fabulous partners from the Americans for Nonsmokers Rights Foundation and the American Indian Cancer Foundation. And I'm going to turn it over to them to let them all introduce themselves. Mike, do you want to start us off?
Sure. So I'm Mike Freiberg. I'm a senior staff attorney with the Public Health Law Center. We are based at Mitchell Hamlin School of Law in St. Paul, Minnesota. We think it's important to acknowledge that's in the Bdote region of the traditional homelands of the Dakota people. And we recognize that the land we currently occupy comes with a legacy of genocide and trauma caused by US law and policy as applied to American Indians. We provide legal technical assistance to advocates working with local units of government, state governments, tribal governments, or just individual policies of businesses, working on policies to reduce the harmful use of commercial tobacco. And we do that by providing education, webinars such as this, fact sheets that are available on our website, but also a lot of one-on-one technical assistance where we can analyze the law and how it's been applied in other jurisdictions around the country. So great to be here. Looking forward to the webinar.
My name is Clinton Isham. I'm an enrolled citizen of Lac Definable Band of Lake Superior Chippewa Indians, which is an Ojibwe tribe in northern Wisconsin. Currently live in Nashville, Tennessee, and I'm the tribal relations consultant for Americans for Nonsmokers Rights Foundation.
And I'm Chris Johnson. I'm the Prevention and Policy Manager for the American Indian Cancer Foundation. I'm enrolled in the Sistenwapton Oyate, so originally from South Dakota, currently live in Phoenix, Arizona. Just a little bit about American Indian Cancer Foundation. So we're a national nonprofit that was established to address the tremendous cancer inequities faced by Native communities. And so we really work to eliminate those cancer burdens of our Indigenous people through improved access to prevention, early detection, treatment, and survivor support. So happy to be here today.
Thanks, everyone. We're going to start out with a couple of poll questions, which will just appear as a pop-up on your screen. So if you want to take a few moments to answer those poll questions, that would be great. Looks like we have mostly non-tribal public health professionals and a good dispersion of people from across the country. Great. Thank you for taking a few moments to do that. So together, our organizations created a new resource talking about smoke-free tribal casinos. So Mike, could you briefly walk us through the resource and how and why it was developed?
We were very happy to partner with great organizations like the American Indian Cancer Foundation and the American Nonsmokers Rights Foundation to develop the resource. With the pandemic going on right now, many tribal casinos closed because of the pandemic, but as the reopening has happened, more and more of them were reopening either temporarily or permanently as smoke-free casinos, which we were very excited about. So, it's kind of a way of making the best of a situation and improving public health in the process. So we put together just a publication. I think maybe Colin can post a link to it in the chat box. And just for anyone that's interested in this topic of smoke-free tribal casinos, it's intended for a variety of audiences, whether they're gaming officials or public health advocates who really aren't used to working with the gaming industry, which has kind of a different set of concerns than we do as public health people. So it's kind of broken up into a few different topics. We talk a little bit about the benefits of smoke-free casinos, provide some talking points on why it's beneficial for people who want to be able to convince officials from the gaming industry that it's a good thing to do. Talk about the importance of laying the groundwork and working with the communities to make sure there's community buy-in, and then some policy considerations that the casino management or the tribe might want to consider, such as making sure traditional tobacco is accounted for, whether or not to include e-cigarettes, the scope of the policy in terms of places. So like, do you include outdoor areas as well? And the policy duration. So, I mentioned some casinos have come back smoke-free just temporarily. Obviously, having a permanent smoke-free policy is better from a public health standpoint. But it's as sovereign governments, tribes will do what works best for them and what they feel is most appropriate.
If I could add to that too, I think it was a lot more difficult to have this conversation before COVID-19 on the level that we've been having it over these past several months because of the importance of respecting tribal sovereignty. Tribes are allowed to create their own policies within their jurisdictions, and if there's a state mandate to do something like not smoke anywhere in the state, the tribes in the state can choose whether or not they abide by that because of their rights to govern themselves. And so it's on a level, it's challenging to walk into a tribal area, especially within like the gaming realm, and ask people to change something that's been working for them for many years. And I think obviously there was a huge shift earlier this year where there's such a need and requirement for and preference for healthier spaces everywhere that organizations like Americans for Nonsmokers Rights Foundation, American Indian Cancer Foundation, and the Public Health Law Center, we've had a lot of these different resources that we've been collecting over the years on the facts and why this is important, and stories and why these types of policies are important. But it was difficult to have that conversation on such a big level before COVID-19. But now everything has changed, and I think I think the thing is we really just want to share the things that we have been collecting for so long with rest of people that support smoke-free casinos, and a lot of the tribes that are already considering making this move or have considered making this move and that are considering making this move. So
I just wanted to touch on, while we'll talk about tobacco, I think it's always important to talk about the differences between commercial tobacco and then traditional tobacco, just as Native people. So commercial tobacco is, the stuff that we all see in the stores, the highly addictive products such as, loose tobaccos, cigarettes, cigars, or e-cigarettes, or chewing tobacco, or hookah. So we all know that commercial tobacco contains chemicals and produces those chemical compounds when consumed. And so we're often associated with addiction and just those adverse health impacts, including cancer. But when we think about traditional tobacco, that's usually not available to purchase in a store. It's usually hand harvested by indigenous people. Many tribal nations grow and harvest their own traditional tobacco. And sometimes it's often a mixture of plants, and sometimes it may not contain any actual tobacco at all. So we just wanted to make those distinctions as we talk about policy and tobacco, that when we're talking about a lot of these tobacco things, we're talking about commercial tobacco and not traditional. We kind of really make those distinctions when we talk about policy within indigenous communities. So I just wanted to bring that up before we delve too deep into this conversation.
Great, thanks for that, everyone. Next, we're gonna show a short video that Clinton and his team have put together, which dives into this issue of smoke-free tribal casinos, as well as touches on tribal sovereignty. So if we could go ahead and share that, that would be great, Stephanie.
and COVID-19, sorry.
And COVID-19.
In the spring of 2020, the Lac Superior Chippewa Indians responded to the global pandemic, COVID-19. Tribal governments like Lac du Flambeau began enacting unique policies to protect their citizens. Policies included curfews, a moratorium on public gatherings, and the closure and reopening of tribal casinos. Equipped with tribal sovereignty, Lac du Flambeau was able to maintain no more than 1 or 2 COVID cases at a time for several months. Now, as the world is responding to its second wave of COVID-19, there are over 30 confirmed cases in Lac du Flambeau. The measures tribal leaders in Lac du Flambeau implemented several months ago to protect its citizens are more important than ever. To Lac du Flambeau and all the other communities responding to this virus, stay safe.
My name is Brooks Big John. I'm from Lac du Flambeau. I am a member of the Lac du Flambeau Tribal Council. Just like everybody else out there, we're on, untethered ground. Since day one, the council's been involved. We established an incidental command team. They meet daily, in the mornings. We went ahead and tried to make our reservation, our homelands more safe for our members here. Not following some of the national trends and state trends, but with our little touch of it too, our little sovereign taste, I guess, if you want to say. Well, Governor Evers here for the state of Wisconsin was establishing dates, closure dates, reopening dates. Some of them things we acknowledged, but we knew that as a sovereign tribe, we could establish our own to make our members and our community as safe as possible. And the little example is when they opened up fishing season here in the spring, when the lakes were open after the ice goes away. We live on a reservation. We have close to 150 lakes on a little 12 by 12 plat, and it draws a lot of people here for fishing and recreation. There's a big rush of people from the cities, Milwaukee and Chicago, and who knows where these people have been and if they've been exposed. And so a step that we took is we closed down all of our boat landings here to try and deter any of that traffic coming here. We meet weekly too with our casino. The tribal council is also wears another hat, and we are the Federal Development Corporation for our casino. And so we've had to go ahead and make some moves and put some safeguards in place for closing and reopening and all that stuff. So been busy.
So that video is a follow-up to a couple other mini videos that we produced at Americans for Nonsmokers Rights Foundation. The first 2 videos that we released were in anticipation of tribal casinos reopening smoke-free. Just around the time that a lot of them were actually closed or closing earlier this year, we had a conversation about what is the best way that we can support casinos right now. And it goes back to what I said earlier about there's like this thin line that we have to walk when we have these types of conversations with tribes. And so what we did was we created these videos, and it was really just to offer this respectful nudge about why it's so important and the financial benefits and the health benefits to other casinos that have already been smoke-free, and specifically other tribal casinos that are smoke-free and that are already doing, I guess, successfully on their doing things in a smoke-free by being smoke-free. So anyways, this next video that we created was really just to touch on the tribal sovereignty piece and why that is so important. And when I was talking about this policies that some states enact and that some tribes don't have to abide by them, we've seen across Indian country that a lot of tribes were really enacting these really unique policies to fight COVID-19 in their communities. So these policies were very specific to their many communities. And the same was with Lac du Flambeau. And I think what a lot of tribes were doing was they were putting smoke-free policies as part of those many different other measures that were enacted. And so something that we wanted to do was just briefly to cover on that, and I guess get more into the story in future videos about the benefits of smoke-free gaming, specifically from tribal leaders. Was
I'm
that
super excited to see, how that grows and see more of those videos come out. I think those are really helpful when we think about advocacy and all of that work. But I just wanted to go through kind of the resource and how it should be used, the different sections to it. I know Mike discussed some of it already, talking about the health benefits and financial benefits in those pieces. But just going through those talking points, those are really used, are meant for, those public health advocates, community members, and the tribal leadership, and really using those, as your conversation guide when you're going and meeting with, casino leadership or other tribal leaders to really talk about this. And when you're considering all of these different policies, just using it as that conversation guide. There's a lot of data points within there as well. And so, pulling all of these different numbers that are available. So while we do know, there isn't a ton of data, but there is some out there. And so we've really incorporated that within this resource. So being able to use those data points to really back up this conversation and really guide that. When we think about the policy considerations, so really thinking about those and taking those into consideration when you're drafting and implementing these actual policies. Just thinking about what commercial tobacco means to the community, what do you want to include with that definition, making sure that you're including electronic cigarettes in there. Like Mike said, really thinking about those areas where you want to smoke or, want to allow smoking, whether that's out, want to include those outdoor areas or not, or designated smoking areas. Like I mentioned, just being cognizant of those electronic cigarettes. And then the big, huge one here that we always think about with Indigenous communities and policy is traditional tobacco. And so really thinking about that while you're drafting these policies, making sure that you're allowing traditional tobacco to be used within these policies, because we know it's not the same as commercial tobacco. And so I think that's really important when we think about that. But I think another big, huge part of that is really defining what traditional tobacco means to each of these communities, because we do know that will vary across tribe. And so it's really important to think about that while you're drafting policy.
And one thing just to mention quickly too is the resource includes contact information for all of our organizations, and we are available as technical assistance providers. So, the ACAF, the American Indian Cancer Foundation, American Nonsmokers Rights Foundation has lots of experience working with tribes, and I'm sure would be happy to hear from you or advocates who are contemplating working on these policies and can help you avoid some of the pitfalls that some organizations might have sometimes working in this area. And if you are at a point where you're ready to start working on policy language, we at the Public Health Law Center would certainly be more than happy to hear from you as well. So there's a lot of good resources that are already out there. A lot of organizations already doing this work. So if it's a new area to you, please reach out to people who've done this work before.
I was wondering if it would be beneficial to kind of go over in more detail. I know we have some time here. I guess just how we came about some of these very specific points, mainly under the talking points, and just how this document came to be. could talk quickly on the talking points. I think whether you're a tribal leader, a gaming manager, a public health advocate, the talking points are going to be different across the board. And I think when we developed this, we wanted the audience specifically to be tribal gaming managers. I've created other talking points specifically for public health advocates. And we've also worked on, if there's anybody in the audience today that are actually from casinos, we've worked on talking points for casinos as well. So a big part of enacting these types of policies is implementation. And so we have some experience in creating talking points for different people across the casino, employees working at the casino, so that they could communicate as to why these policies are so important. And so it'd be really different across the board. We'd have different talking points for like security guards, different talking points for cage managers and things like that. And so I could definitely help with those resources, or we can all help with those resources. I have some templates that I've worked on to create things like that. And it's just a very vital component of, I think, these types of things becoming successful and normalized.
We have one question, and I think it's an appropriate time to ask that from an audience member and attendee. And the question is, would traditional tobacco be used in a casino, or is that more in a broader ceremonial setting?
So I don't think you would ever really use it in the casino, but when we think about where these casinos are, they often have, conference centers attached with them, hotel rooms, things like that, where you might use commercial or traditional tobacco. And so you really necessarily wouldn't be using it in the casino, like sitting at a machine, like you would for, say, like a cigarette or an e-cig. But thinking about all of the other amenities that these casinos usually have. So I think all of us on this panel have been at a conference where traditional tobacco was used, things like that, thinking about the broader sense of all of the amenities that they have. Does that answer the question? And Clinton, feel free to hop in there as well.
I was going to say, I've been to a lot of different tribal council meetings where they would have them at the casino, or board of director meetings for tribal entities that they would have at the casino. And usually for tribal entities or some council meetings, they'll use traditional tobacco and start the meeting by smoking a pipe. And so I've seen that done, but again, traditional tobacco is not recreational, like what Chris said. So it's not something that you would use leisurely while gambling at the casino, but it's still important to have, especially at tribal casinos, to have those policies be culturally responsive and have the cultural components within them, such as the definitions of the different types of tobacco, and specifically saying that traditional tobacco is allowed, because there are going to be times when tribal people, tribal leaders or other tribal elders and cultural leaders, they're going to be at these casinos wanting to use traditional tobacco, and they'd probably use it either way, but it's just easier for to have the staff trained on the definitions so that it be clear for, say, a non-tribal staff member walking into this meeting and seeing tobacco being used, that they will have the training behind it to know what to say and know how to respond in those types of situations.
Very good. I think one thing we wanted to touch on too, and seeing as our poll results, most of the folks were non-native public health advocates. So as those folks, how can they help work towards smoke-free tribal casinos while still respecting tribal sovereignty? So what are some of those things that non-native folks can do to help?
I can, so the Public Health Law Center is not a tribally led organization. We do have tribal members on staff, but, generally, historically, we've tried to recognize, our limitation in this regard. So we seek to partner with tribally led organizations and advocates working directly with tribes or members of the tribe themselves whenever possible. And ideally, we can work with tribal partners to help them exercise their sovereignty to protect public health. We've certainly done everything we can to raise our expertise in the area, but we recognize we may not always be the most appropriate entity to work on a tribal initiative. It could be because of historical trauma or institutional racism, and there may be situations where we need to just step aside to let tribal partners exclusively work on an issue. But just generally speaking, we recognize that tribal partners and tribal community members must take the lead on these initiatives for there to be community buy-in on a policy.
I think I can also add a little bit to that. I think it's really important for our non-Native advocates and partners to really remember that smoke-free policies are dictated by the Native communities. And so, due to tribal sovereignty, so every community is different in how they operate their gaming casinos, and in turn, those smoke policies that they choose or may not choose to implement. And so just really ultimately understanding that those communities will know how to best implement these policies based on the needs of their people. And so really, letting them guide this work, like Mike said, but also, respecting that tribal sovereignty. And it's really just important to listen and serve as a resource where you can meet them based on their needs. And so really being an authentic partner and respecting that they know what they want to do, and that's going to work the best, and really trusting that wisdom.
I love to add to this question all the time. And I think something that Mike covered earlier when he was introducing himself and the organization kind of hit it spot on. I think it's very important for non-tribal people, if they want to build trust and relationships with tribal communities, that they have some sort of research, or they've done their research around tribal communities. So what that means is, looking at where you live and historically who's lived on that land and what tribal nations are currently living on that land. And really just acknowledging that. And if you want to go a step further, learning more specifically about that tribe that you just learned about, researching the culture, the history, the sovereignty around that specific tribe. And I'm telling you guys that it really makes a difference when you are educated, self-educated with that type of information, and you walk into a room that is tribal or that are working on tribal issues, and that stuff. It really does show, and there is a level of, I think, trust that comes automatically with that, because it shows that this person cares, or this organization cares, and they've done their research around it. And another thing is be flexible with your funding. There's tons of ways to do that. If you're a program manager, program director, having conversations with the different administrators that you work with. And if you're already working with a tribal community, and try to be as flexible as possible with the funding that you have, and seeing if these tribal communities need help with anything as far as funding goes. So
great. Did you want to add something, Chris?
I was just going to add, thinking about the timeline of these things, they don't always move as fast as we'd all like them to. So really keeping that in mind as we partner with tribes and tribal nations, that these things may take some time. They may not happen overnight, although some of them, may have happened overnight, but some of these things may take longer. And so just keeping that in mind while you're working with these tribal nations and tribal casinos.
Great. Another question we had was, we've touched on this a little bit about the need for these casinos and tribes to pass permanent smoke-free policies. So what are some important things to consider when working with tribes to pass them to be permanent policies so that they remain smoke-free in a post-COVID world?
So if I could go back to the talking points and specifically talking about the importance of creating talking points for different areas of the people you're working with. A couple of years ago, we were organizing smoke-free policies with powwow grounds in Lac du Flambeau. And this is an outdoor powwow ground, and nobody ever thought it'd be smoke-free. Like, it was impossible to have a powwow ground be smoke-free because a lot of tribal people smoke cigarettes. And so what we did was when we created the signs, we worked really closely with all different levels of people organizing at that powwow. So we worked with the drummers, we worked with the MC, we worked with the vendors, we worked with the ticket booth people, and we had talking points to implement the policy so that that it could garnish community support, really. Like, that's what it really was for. And so at every level, when people, guests would come in and they would light up a cigarette, there'd be somebody there to kind of intervene and talk about why it's important, and not necessarily say, hey, put that out or whatever. There was a designated smoking area, and we talked about the cultural significance of our tobacco and why it was important to really to decolonize our tobacco so that we could have it more accessible in our communities. So anyways, a couple months went by, and this powwow arena, it attracts a lot of people, a lot of different tourists, and we have powwows there every week. Eventually, we didn't need to intervene. It was just like, it was normalized, and people weren't smoking in there. And I think the biggest thing is community support and patron support of these casinos. So we have to collectively send them a message and why these policies are so important. And I think, non-tribal public health advocates can help with that. Tribal public health advocates can help with that. And a part of us creating these resources and these videos and everything else that we're doing is to really create energy so that we can work in sync to have those types of conversations with community members and patrons, that these policies are so important and they work and they are going to be more beneficial financially for tribes, and tribal people are going to be a lot healthier.
We just had a question come in that fits in nicely, Clinton, with what you're speaking about. And it is that some tribes went smoke-free during the beginning of the pandemic and have since announced that smoking is now allowed. What are some strategies for working with those tribes, given that they have likely had a discussion and made the decision already to allow smoking again?
So that it's a difficult thing because the tribal leaders have already made that decision. And so at some point, we have to respect that decision. There's nothing that I can do to change that because they know what's best for their community. But I think before that happens, we've implemented different things to help tribes not go back to being not to letting cigarette smoke allowed at the casino. Sorry. So there was a casino that went temporarily smoke free, and we had the same conversation about how do we communicate with these community members and the tribal leaders about not reverting and to implement permanent smoke-free policies at this casino. And what we did was we worked with the tribal health clinic, and we created signage and banners in high traffic areas that just said thank you to this casino for being smoke-free. Even though it was temporary, we said thank you to the casino, and we listed the different reasons and why we thought it was so important. And it wasn't our organization, it was coming from the health clinic. And so it's this health clinic who's this leader in the community, sending this message to community members, daily. These community members are reading these signs daily, and hopefully tribal leaders are also reading these signs daily. And we also had a banner on the highway where there's a lot of traffic moving back and forth. And that casino hasn't made a decision yet, but I think going back to that, how do we, garnish this community support? I think it's working with all different types of entities in tribal areas and really just getting us all on board and how we're going to communicate with community members and patrons to for them to speak to casinos and say, we want this to be smoke free, because it's really going to be the patrons that have a big voice in this. And so just messaging at every point, at every opportunity that we get.
I think that really, brings up the importance of community engagement and community involvement and really gathering that community buy-in. Early on, when we think about all of these different policies and policy efforts, really any policy effort within the tribal community, just the importance of that community engagement, really gathering your stakeholders, bringing them together to really talk about, what it is they want, how they want it. Clinton mentioned talking to the patrons, surveying your patrons, the importance of, the customers really putting their feedback in those comment cards that are at all of the casinos and saying, hey, we really love this, that there's no smoke here, all those different things, and how that it's really important to do that. Just communicating all of those changes, like Clint said, things like that, I think that really speaks to the importance of that, so that the community really holds their casino and tribal leadership accountable to these policies, and that they'd like to see them go, further as COVID ends, when that happens.
Chris or Clinton, I'd be interested in knowing how much financial considerations play into a decision whether to go permanently or temporarily smoke-free. I mean, I know the experience from Ho-Chunk Gaming Madison, when they went smoke-free initially, they initially saw a decline in casino revenue, but then ultimately it surpassed the level it had been at. I just kind of wonder, have you found efforts to educate casino management successful, just on the risks? Like, I imagine if they temporarily go smoke-free, there's a risk that they'll see that initial decline in revenue and not get to the point where it actually surpasses the what the revenue had been prior to going smoke-free, because more people do want to be in smoke-free environments, I know is generally the experience. I guess I'd be interested in your thoughts on that.
So we know anecdotally that smoke-free tribal casinos work. 5 years ago, Ho-Chunk Gaming Madison went smoke-free, and they experienced that decline in revenue. But after a few short months, they have then seen their revenue kind of increase at a level where it's never been before. They're very vocal about that, and we've worked and partnered with Ho-Chunk Gaming Madison to help get those facts out there even before COVID, but they've really helped in a big way this year with communicating some of those things that worked for them and the financial benefits that have worked for them. But I think what we're seeing now is something Chris was talking about, was that there are a lot more surveys that are coming out now about, I'm gonna let my cat in, about casinos that are smoke-free. So for example, Park MGM recently went smoke-free, and they're the largest, or not, I'm not sure if the largest, but they're a casino on the Strip, and they're the only casino on the Las Vegas Strip that are smoke-free. And they are having overwhelming support for smoke-free policies, and they're finding this out through surveys. And so there's a lot of new information coming out about this. Like it's still very brand new. These casinos are in the very they've just opened a couple months ago, and I think what they're going to find through surveys and through the comments from their patrons and things like that is that there is going to be support. So I think it's just a matter of holding on and waiting for that information to come out, and because everything is shifting right now. The information that we had before, I'm not sure if it's relevant anymore, but there's, everyone's preference is shifting, attitudes are shifting. And so we really have to listen to the new information that's coming out from these casinos right now.
Great, good discussion. We have quite a few questions coming in. So this one fits into some of the policy considerations we were discussing. The question reads, for the tribal communities that are going forward with smoke-free casinos, are some designating a smoking area at all? For example, outside of the casino, like a smoking hut or smoking area. Maybe someone could touch on what's being done in that, and then some considerations when dealing with that issue.
I don't know the numbers that are doing that. I know it's a discussion that often comes up when talking about smoke-free indoor policies. Like, I know it comes up in the multi-unit housing context as well. Just from a policy standpoint, I think, from a public health standpoint, it's preferable if there is a designated smoking area, if it be set off, a certain number of feet from anywhere that anyone entering or exiting the casino has to come, or potentially away from ventilation intakes as well. You probably want it to be an outdoor area as well, just so that people who work there, if they have to go out to clean it, don't have to breathe in secondhand smoke. And we found they're generally successful even in cold weather areas as well. Even if it's an outdoor area. I'm in Minnesota here looking at the snow out my window. It is, in areas like this, they can be done successfully even in outdoor areas that are set aside some distance from any entrance or exit. But I don't know exactly what the numbers are in terms of how many casinos have designated smoking areas in place.
Great, thanks, Mike. There's another one that is talking about traditional tobacco. So in the terms of policy and due to sovereignty, should the policy include language that does not prohibit smudging? Finally, to garner support, what is the language that non-tribal members should use when partnering with tribal communities?
Do you want to take that, Clinton, or do you want me to? Okay. So in terms of like the tribal sovereignty and the policy piece, I think that is important to think about the smudging and all of those practices that go along with this as well. So that, if that makes sense for the community, then by all means that should be included. And as for the, the naming and how we want to refer to tribal nations and tribal communities that we work with, I think it's really a preference thing. I know a lot of different folks say different things, but for the American Indian Cancer Foundation, it's always either, American Indian or Indigenous. And then when we're talking about working with tribal nations, obviously, really being cognizant of that just due to tribal sovereignty and that nation to nation relationship. So we always think it's very important to acknowledge that when we're discussing that.
Great, thanks, Chris. There's another question too, thanking Clinton and Chris.
Like specifically tobacco prevention advocates or like tribal casino advocates? What kind of advocates?
It wasn't specific, but maybe the participant will respond. But I know that these guys are very well connected across Indian country. So reaching out to them, I would bet that they could help you connect with someone in your local community.
I just want to say there's a lot of tribal communities will have their own different community coalitions. And I'm from Wisconsin, so at least I know this is true for Wisconsin. A lot of the different communities would have like an anti-drug coalition or a wellness coalition. They take on a number of words, but it's usually a coalition. And if you live next to a tribe and you are wanting to be involved more, I think that that's a perfect place to get started, is with those coalitions, because they're public. They're usually comprised of tribal and non-tribal people, and these are non-tribal people that work in the community. And it's a really good working group that covers a number of different issues across the tribe, including tobacco prevention. So just do your research on different tribes and see if there's a coalition there that's available to help you. And if not, look at the other tribe and see if they have a coalition and if they know about that other tribe you want to work with specifically.
Yeah, just to kind of add on to what Clinton was mentioning, a lot of tribes even also have like a tobacco coordinator. A lot of tribes will have tobacco programs within their communities, and maybe even their clinics, things like that. So there are folks that are focused solely on tobacco within a lot of tribal nations. So important to reach out to them as well. And like Colin said, there are a number of other organizations that are working on tribal tobacco as well. We think about the National Native Network or Clearway, Minnesota. So there are other folks out there that are doing this work, and I think we're all pretty well connected. So if you reach out to one of us, I'm sure we can connect you to where you need to be.
Great. Another question that we had, and feel free everyone to, now is a great time to put in your questions into the Q&A as we wrap up our time together. But we had some registrant questions that came in earlier, and one is there a list of smoke-free tribal casinos available online? So Clinton, do you want to talk about the resource? And we will put that in the chat right now.
Yeah, so the American Nonsmokers Rights Foundation has been maintaining a list of smoke-free casinos, both tribal and non-tribal, for many, many, many years. And for a long time, that list for tribal smoke-free casinos was at 5. There was 5 in the nation. And today, through all this great work that's happening over these past several months, and really thanks to tribal leaders who are making these decisions, there are 135 tribal casinos that are 100% smoke-free. And so if you go onto that list, they have both tribal and non-tribal gaming facilities, but it's pretty clear how to kind of read between the lines and see which ones are tribal and not.
Great, so that resource is now in the chat that Clinton was just talking about. Another question that we got prior to this meeting was, are there other ideas for collaborating with tribes on public health issues, including the sale of cigarettes on tribal lands and related enforcement issues on non-tribal lands? Does anyone want to take that question? Other work being done in the area working on sale of cigarettes or enforcement issues on tribal lands?
I mean, as I guess I'll just say, as sovereign governments, tribes have the ability to work on any commercial tobacco control policy or policy to reduce the harmful use of commercial tobacco that any other government would have too. So I've done some work with some on just general smoke-free policies. I've done some work on tribes interested in tobacco 21 policies or other restrictions on the sale of commercial tobacco products. It's important to know, I guess, what the community is interested in and what they view as the biggest public health issue when it comes to commercial tobacco in their community. Some may not really be doing much commercial tobacco work at all, and that's fine. But as sovereign governments, I think when you're talking about commercial tobacco control, generally you talk about like a three-legged stool where there's youth access laws, there's smoke-free laws, and then tobacco taxes with funding for programs to reduce commercial tobacco use and cessation programs and so forth. And certainly any of those would be an option for tribes that want to exercise their sovereignty as well. And I know many have worked in those areas too.
Mike, we just had an attendee from Oklahoma ask, does preemption govern tribal nations, or does preemption apply to tribal nations?
I would, short answer is no. I mean, they're sovereign governments, so they can work on their own policies. For those not familiar, preemption is when what you might call a higher level of government tells a lower level of government that it can't regulate a certain area. So in some states, they tell cities and counties they can't pass smoke-free laws or laws restricting the sales of tobacco products. And that's not a concern with tribal governments because they're sovereign.
Great. And I think this next question goes back to Clinton, the list you were talking about. Are those casinos vape or electronic cigarette free as well as what we think of as normal combustible tobacco?
I think a lot of casinos lump in vaping the same way that the feds have, with that they are considered a commercial tobacco product. So when they create these policies, when they say tobacco free or smoke free, they also would definitely include vaping, as far as I know. And a lot of tribes are specifically putting it into their policy as well, or tribal casinos.
Great. I don't think we have any other questions appearing. Do any of you all have anything else you'd like to say as we wrap up? No?
I guess I just want to thank Clinton and Chris in particular for sharing their expertise with us on this webinar. It's great to have partners like this, and it was great to work with their organizations on the resource. So it was a lot of fun.
Great. Well, thank you all for joining us today for this discussion on smoke-free tribal casinos. I hope you learned something, and again, feel free to reach out to any of us. As mentioned, our contact information is on the resource, so please don't hesitate to do so. Also, we'd really appreciate it if you took the evaluation survey after we conclude. As Stephanie mentioned, it'll pop up when you click out of the webinar, and will also be emailed to you. So thank you again for taking the time to join us today.
Thank you, guys. Thank you, Mike, Colin, Chris, Stephanie.
That's all.